President Cyril Ramaphosa receiving the Johnson & Johnson COVID-19 vaccine. It is going to be done effectively, and as we get more and more of this vaccine, as the minister brings them in, I think we will be able to vaccinate up to 40 million South Africans that we should, said Ramaphosa, speaking shortly after being inoculated with the newly acquired Johnson & Johnson vaccine at KHAYELITSHA District Hospital in the Western Cape. Ramaphosa thanked the staff for their efficiency in administering the vaccine, which arrived in South Africa on Tuesday.
Had a little bit of a sore arm for literally less than 24 hours and no other side effects whatsoever. I do anticipate having a few more next week when I get my second dose. That's typical, but again, it's a sign that my immune system is working, so I'm not necessarily dreading that.
Absolutely.
To see the numbers get worse before they get better. And sure, I understand that people wanted to see their family. People need to keep in mind, however, that they don't want to become a statistic themselves, and they certainly don't want to transmit to other vulnerable people. If you did travel for the holidays and you returned home yesterday or today, you should essentially quarantine yourself for about 7 days and get tested in about 3 to 4 days, and continue, of course, mask wearing and social distancing. That's the best guidance right now.
Okay.
We do know that it is more contagious, about 70% or so more transmissible. At the moment, it does not appear to be more virulent. That is, it doesn't cause more severe disease. It doesn't appear to be deadlier. And for now, we think that the vaccine is still effective and protective against the variant. It's important, however, to point out that just because it may not be deadlier per se, just by sheer numbers, the absolute numbers of hospitalizations, and then following that, deaths will happen just because more people will be getting infected. And the best protection is what we've been saying all along. I don't need to repeat myself. You know what you need to do.
Less than a week after the country launched its vaccination program against COVID-19, more than 10,000 healthcare workers in South Africa have been vaccinated.
It's part of the 80,000 allocation. So the number can keep on changing because it's a national program. So the last time I checked, it was going to be 13,000 divided into the Tygerberg and Grooteskill sites. But noting it doesn't mean that all of them, they will be for the specific hospitals, but it's about Metro East, Metro West, and then they've got the feeder facilities within that. So that's why we're here in KHAYELITSHA, which is part of the feeder for the Tygerberg site. So that's how.
And are you glad that you're kicking off the vaccine rollout in KHAYELITSHA Hospital?
They were going to get it anyway because they will form part of the Tygerberg site anyway. But the issue of the equitable access is crucial because it shouldn't be only hospital-based. Like I'm wearing the EMS just to show that they are part of the healthcare workers, just as is also other health professionals. But because we've got the minimum allocation at this stage, it means that we have to focus more on the metro, and then we can do the rural later stage. Plus also because it's part of the implementation study for the research, it means that they still have to have access to the vaccinees, and therefore that's why I would find that you might not be able to do all other categories at the same time.
Thank you so much. Thank you.
President Cyril Ramaphosa and Health Minister Zweli Mkhize joined health workers to receive the first COVID-19 vaccine on Wednesday. Health workers are the first in line to receive the coronavirus vaccine. Caroline Matsane reporting for TGT News.